Hello and welcome. This is our Friday feature interview, and we are very lucky today to have Judy Terwilliger with us, joining us all the way from Sacramento, California, and also my co-host, Rebecca Fairway. And Rebecca, where are you joining us from today?
I'm joining you from South Africa.
Yeah.
South Africa.
Wow, that's awesome.
So we make it work wherever we are. We just
being a massage therapist is amazing.
we bring this to you because we are so excited about having our guests. And our guest today, Judy Terwilliger, is an exhibitor at our Alliance for Massage Therapy Educational Congress coming up July 25th through 27th in Philadelphia. And we are going to learn a little bit more about why you need to make sure that you drop by Judy's booth. In fact, let me tell you just a little bit about Judy. Oh, let me introduce myself. My name is Jody Scholes. My co-host is Rebecca Fairway. And as I mentioned, our lovely guest, nurse Judy Terwilliger. Judy is a registered nurse for 39 years, almost 4 decades.
I know.
And she's concurrently not only a nurse, but also a licensed massage therapist and a functional mobility specialist. Judy currently oversees a very busy pain management practice in Sacramento and works extensively with rehabilitation physicians, pediatric healthcare practitioners, and other allied healthcare professionals, specialists, to effect change across a broad range of myofascial muscular pattern dysfunctions. Her clients range from babies to senior citizens, and she promotes functional mobility with a focus on this wellness paradigm we're going to talk a little bit about today. But Judy developed a technique that you'll want to learn more about. It's called the functional Bowen method, and many of us consider it one of massage best kept secrets. But it's not going to be a secret for long because Judy teaches nationwide. And the functional Bowen technique is focused on affecting fascial change where there's been a disruption of any kind from an impact or from congenital defects. Judy will have an exhibit table at the Educational Congress in July this year. Join us in Philly to see Judy there. We're really pleased to welcome our feature Friday interview with Miss Judy.
Judy, welcome.
Sure.
And can I add something really quick?
Sure.
So Judy, I own a massage therapy college, and there are a lot of massage school owners and then CE providers that attend the Educational Congress. And I really appreciate you being there because we are continually looking for really great continuing education for our graduates. And so it means a lot to us to have quality educational opportunities for them throughout their lifetime career. So I've watched a little bit about your work, and I'm excited to meet you. Excited to have this interview with you today.
I'm pretty excited myself.
Yeah, it's going to be amazing to learn a little bit more about this. Yeah. There's an awesome little 12-minute video that I'll put a link in the comment section below that you can learn a little bit more about one area of Judy's work. But Judy, without you, for our folks who don't know a ton about the functional Bowen technique, they don't know your technique, but what we do know and what you're here because of is because you're committed to such high quality continuing education.
Absolutely. I'm a scientist at heart, and I bring my Western medicine background and I merge it with the complementary medicine I've developed through this Bowen technique, this functional Bowen technique.
It's just terrific to have the dual strength of being a nurse and a licensed massage therapist. What's one thing that you would say you or your organization does that promotes high quality educational standards for massage therapists?
Well, first of all, the California legislature, the California government, you might say, the California Massage Therapy Council has worked really extensively with the American Massage Therapy Association as well as ABMP to try and bring the standards to bear here in the state so that we can have, like my nursing license is good anywhere in the state. We wanted to have that standard so massage therapists and body workers could have that same privilege to be able to go county to county or city to city and have the privilege of being able to work anywhere. And I went before I did some work with the City Council of Sacramento, brought letters of support from more than 16 or 17 physicians and chiropractors and other healthcare practitioners locally to try and support and promote that. In addition, because I do support the CAMTC and what it stands for, I don't hire anyone in my office who's not CAMTC approved, so that I'm maintaining a business standard that supports that educational property.
And for the listeners who are not from California, could you tell us what CAMTC stands for?
California Massage Therapy Council.
Yeah, so that's your governing body there in California.
Yes, it is.
Yeah, excellent. And Rebecca, we were talking earlier, did you have a question you wanted to ask Judy?
Yeah, so I really appreciate your contributions to the massage therapy profession. And we were both curious, what first inspired you to go from being a nurse to entering the massage therapy profession? I see this happen a lot with nurses, but I'm always intrigued as to what the catalyst was. What was that moment?
Well, let
when you
me
decided?
let me clarify a point. I still am a registered nurse, and it's not that I don't use my nursing. This is what I do with it. In addition to the massage therapy license that I have, I use every bit of the assessment skills, the medical background. It's all a part of who I am. But I think that nurses as a whole are healers and they are educators. And a lot of the profession has been stymied because it's been turned into a technological, I want to say, a pitfall. Sometimes you spend more time pushing buttons on a computer screen that you roll around than you do hands-on bedside nursing that you feel like you're making a difference helping people. So, but in addition to that, I got hurt back in the early 2000s, and Western medicine failed me. And what helped me the most was the traditional Bowen therapist who came alongside of me to keep my functional mobility happening while the medical profession fiddled around with my health. And when I got out of the situation that I happened to be in at that time, it was that complementary medicine I was looking to be a part of.
Oh, that's great.
Yeah.
Great. I love that story. And I find so often that a catalyst for, in your case, adding massage therapy or adding something to another profession is that life-changing experience.
It was personal pain, and I can relate to those 1 in 3 Americans that are in chronic pain because I lived for almost 3 years on opioids, and I never want to go back. It haunts me, and I just I know that sometimes we wonder, okay, well, what fans the flame of what you do, and that would be that experience. It was life-changing for me.
That's amazing for your clients, the patients, people you work with, that you actually have experience time on painkillers and that you've seen the scope of what they can do and the limitations of what they can do.
Right.
It's actually an amazing experience for you to have, even though I never would have wished that pain on you.
Right. And I do what I do because I want to prevent other people from having that hardship in their life, and where I can't, to bring them out of it as soon as I possibly can humanly.
I love that.
Yes. Yeah. And we've learned recently from other medical professionals that are in allopathic medicine, 2 doctors that were at the school summit. I'll be attending the International Massage Therapy Research Conference in just a couple weeks. And one of the opportunities that I'd love for you to speak to, Judy, is the opportunity for massage therapists to learn the language of healthcare. It seems a little daunting. And yet you're hiring massage therapists and they're having to deal with traditional medical Western doctors.
Correct.
How do you coach them or coach your continuing ed students on dialoguing with traditional medical professionals?
Well, What I do is I involve them with first written letters and writing to physicians and helping me to write physicians. Currently, I'm the one responsible in my office for putting out medical reports to physicians, but they're the ones that support and undergird me in that. So I have trained them how to write SOAP notes and how to write what you would call background information if they're seeing a patient, and what their personal pain assessment is, and where their adhesive hypertonus is. I explain that to them. I say, we need to speak in terms that medicine and Western medicine can understand, so that we can gain the credibility that's required, so that they'll continue to take what we do seriously. And I might add that that's why I really believe in the standards that you've put forward, not only because they were written in part from the nursing standards, I noticed that when I went through them, but that it really does give teeth to what we're trying to do, what we're trying to accomplish, and elevate that task of being taken seriously. I look back now and I think, of all the things that have helped me the most in my bodywork career to date has been my nursing license, because when I put that clinical RN therapist on it, they take me seriously. They don't just push me aside as someone who doesn't seem to count. And I think that part of that is because I have that license to lose if I do something that's not appropriate. And they know that I've had that training and background. And that's why I think that having standards for massage therapy here in the state of California is a good thing. And I think that having standards for teachers is a good thing, because I think it puts us all on a higher plane, and it gives us the opportunity to speak to Western medicine and to be not seen as alternative, but to be seen as complementary.
Yes.
So that's why I'm kind of a herald for that sort of situation. I hope that wasn't too wordy.
No, I really appreciate your point of view on this, because it can seem intimidating to a licensed massage therapist or a certified, depending on what state you're in, certified massage therapist, to consider dialoguing and being open to some coaching, from the dentist or the doctor or the chiropractor that's referring. Some hospitals are putting together a care team that includes massage therapists,
right?
And therefore, we get an opportunity now to really up our game.
I think that's really important, because what we do is we are a part of the healthcare practitioners' circumstance, in that we're actually a part of the healing of people's lives and pain and hearts and souls. I mean, it's all there. That's why I appreciate being able to use my nursing license to be able to assess and correct, more assess and visually, if you want to call it chemically, because I understand the medications, and I don't require that of my staff, but I do a lot of teaching of them, and we have a lot of one-on-one. Like last weekend, I did a pathology class for 3 of them, and so we're constantly upping our game, and I want to make sure that that the organization knows that I support that higher level of education, and I support that reaching out to the medical community and saying, take us seriously. We do good work.
Well, that kind of segues into our next question. So at the school that I have, we have a 900-hour program, which I think is quite a bit higher than the requirements in California. That's our standard lowest level program for massage therapy education. But the AFMTE recently started a teacher certification program. And I went through it, and it was wonderful. You have to send in lesson plans and videos of your teaching, and you have to meet all of the standards they've established. And so how do you see that impacting massage therapy education? Do you feel like that would be something that additionally would give credibility? And in what ways do you see that creating change?
Well, I think, again, that it will create, it is going to encourage like I said, I believe in the standard for the massage therapist, the licensed massage or certified massage therapist. And I think that the standard for teaching gives, again, the medical profession, I keep referring to them because they're the ones that if we're going to have a problem, it's going to be, we're bumping up against them. However, I might say that I've gotten a lot of positive response out here in California. Maybe it's just because we're out here on the Gold Coast, but I don't know. But I do think that the massage therapy community gets a little bit, it's getting a little bit more credibility out here than maybe some other places. I know back east there's a lot of, I'm from Ohio originally, and I think that, there's a lot of pushback. And so I just think that this teaching credential will lend more credibility to the students taught, and give them a little bit of an edge over their peers that may or may not be taught by someone who has a higher level education.
Yeah. But and Judy, you'd be happy to hear that in Utah, where I'm from, which is in some ways progressive, but in many ways probably Ohio and Utah have some similarities. But we have a wonderful response from mainstream medical community, and that they're willing to partner with us, and that they do take our profession seriously. And so I agree that this will further enhance that. The sun is setting here in South Africa. I'm so sorry if I ended up just completely in the dark here, but still a voice.
Well, we only have just a few more questions for you, Judy.
That's fine. Go ahead.
Yeah. We've been talking about quality education. We've been talking about, our students and kind of maybe, our new graduates, and maybe even some long experienced graduates feeling a little intimidated in dealing with healthcare professionals. What advice would you give? My first part of the question is, what advice would you give to someone who would like to explore partnering with another medical professional? And then if there are any trends that you're seeing in our profession, could you share also kind of what you're seeing?
Wow. What would I recommend, or what could I suggest? First of all, be bold, and be not. I'm not trying to say be overly bold, like be cocky, but what I'm saying is that what you do is important. And if you come to the table, or you meet with the doctor or the chiropractor or whoever you're working with. I mean, because I even know out here that we have massage therapists that are now located in physical therapy offices. So I think it's going to that person in a professional manner, taking a resume and saying, I really would like to let you know that I'm here in the community and I'm available. I would recommend offering a technique demonstration to them, and or offering your services at whatever that they're sponsoring, or the local community say, do you participate? We have a lot of community participation things that you can get involved in out here. But I'm just saying, if whoever it is you're trying to talk to that is a medical professional, I would say just be bold and be, I would say put your best foot forward, and know that what you do is important, and have a game plan that you want to talk to them about, whatever you're able to do on your own to help them understand you better. Give them a resume, tell them where you are, how long you've been in business, what your aspirations are. I think people want to know. This is not something about, how much money are you going to make? It's more a matter of, what is your personal goal in helping people, and how can you best contribute to their organization? And I think that just getting somebody to give you the time to share that gives you an open dialogue with them to help further that discussion. And as far as trends, I just think that with 1 in 3 people in chronic pain in the United States, which is my understanding, from Dr. Scott Fishman, who is the who's who on pain management out here at UC Davis, and he's a national speaker, international speaker. It's chronic pain has bypassed motor vehicle accidents and all the trauma that's caused from those. And so I think that there are more and more doctors are more and more, they don't have answers. Mm-hmm. And we're giving them answers because what we're doing is we're looking at the whole person and saying, how can I apply the healing arts? How can I give these people a chance to heal from the inside out in a non-threatening, non-drug environment? And I think that that's why they're giving us, I mean, when they don't have answers, you can't argue with the success. And so I think that's what they're seeing as a part of what we do. And I think that's the trend I see, that more and more they're opening up to, I mean, for heaven's sakes, we now have the study of the interstitium. I laugh because fascia's been around for a long, long time. Yeah. And, you know, we're just catching up with Europe. But the whole point of, you know, how to deal with people's pain is really, I think, where they're getting to listen, where they're being forced to listen to us.
Mm-hmm. Absolutely. That's an amazing, thank you so much for sharing that trend. One of the statistics that supports your point of view is that a very reputable organization, National Institutes of Health, reported that the psycho-spiritual, emotional cost of pain that is
staggering
is $635 billion a year. And fully 1 out of 3 people in the United States reports to be in some kind of pain. And so doctors are trending towards being more open. And I would fully support also your recommendation to be bold and to have that show up in the form of confidence, and knowing what you offer, and dressing appropriately, having the resume, but standing firm in your truth that this is going to do some good for those patients. So
just asking for the opportunity to give some, give what you have to offer a try.
Mm-hmm. Give it a try. Mm-hmm. Hey, speaking of give it a try, why did you become an exhibitor at the Alliance for Massage Therapy Education's Educational Congress?
Well, I wanted to do more than give it a try.
Yeah. That's great. What do you hope to gain?
What I really wanted to do, I hope that's not too awfully informal. What I really wanted to do was to bring, first of all, I wanted to support what I see that the organization is trying to do in the way of education. But I want to bring to the forefront what I do in functional bone therapy, because I focus on the body as a whole, a global unit, and I want to focus on the subject of fasciology, which I think does not get enough credence. It's what gets involved in all muscle pattern dysfunction, just because the fascia gets, we'll call it clumped for a better way to put it, and that creates pulling and dysfunction. And that's what I directly address with my technique, because of the assessment. Again, my nursing skills bring to bear there. The assessment that I teach and the actual, it's an assess and correct program. And I want people to understand that it's available, it's out there, but at the same time, I want to bring to light that really, I don't think fascia gets more than lip service sometimes. I read an entire book recently on a subject that's near and dear to my heart, and it's tongue tie and the issue of ankyloglossia with babies, infants, and children, because I teach that. As a matter of fact, I'm going to Bristol, UK next this June, and I'm going to be teaching there. But this subject got, I don't know, 3 lines in the whole book, and I was depressed. I mean, it was difficult. So I'm getting in touch with the author. I'm being proactive and saying, did you realize that you kind of missed this boat? And I'm going to be pleasant about it and see if I can encourage him a little bit. But bringing that to bear in the massage therapy community, because there's for those of you who've never watched the video on YouTube, it's called Strolling Under the Skin by Dr. Jean-Claude Guimberteau. it's fascinating. You'll never touch someone ever again the same way, because every time you touch someone, you're moving fascia. You're moving living tissue that brings ebb and flow and movement to life, which is essential. So that's really why I'm coming, is to bring some insight, not that people don't know about fascia, but to bring some insight from my perspective, and to bring some information on course materials that people can actually learn how to, in a more, I don't want to say rapid fashion, but a more efficient fashion, actually affect positive change in the fascia of the patients that they're treating.
That's beautiful. I love that those are your compelling reasons, and I'm grateful you're going to be there. Speaking of informal, nothing could be more informal than this very uncontrolled.
Been doing this in the dark. I'm so sorry.
Like, oh, please, can you be more proper, Judy?
That's okay.
Keep this controlled. Like,
Judy, you have a favorite quote, do you?
Yeah, I do. I just want to make sure I don't get the guy's name wrong. I'm a fan of cheerfulness, and my quote is from Pindar, he was a Greek poet in 517 BC, and he said, "The best healer is good cheer." In the Psalms, it also says, "A merry heart doeth good like medicine." So my thought that I leave you with is that when you actually take care of people, and when you share who you are of yourself with others, I guess ask yourself, what is the most positive thing you can say, or what is the part of you, how can you bring relief and comfort to them because of the way that you handle your countenance? It can be really challenging. So, I mean, this is the pot calling the kettle black. So I'm just saying, it's not because I've arrived in any way, shape, or form, but I just think that a cheerful heart makes a big difference.
I think that's a lovely sentiment to wind down on.
Well, thank you.
I love it too.
I look forward to being at the conference, and I'll be bringing one of my recently new staff members, David Leary, with me. He'll be a delight to meet as well.
Oh, very cool.
Oh, so great. Well, Judy, I'm so glad that you could join us, and I realize it's a little difficult to take me seriously right now.
I'm doing just fine with that, Rebecca.
As the sun is set here in Africa, but I just want to say thank you to you, and we're really excited. For people who want to know more, they can visit you, Judy Terwilliger, at knowmore.com, knowmor.com.
.org, actually.
Is it .org? Okay.
Yeah, www.knowmor.org.
Okay, great, good. And I also want to thank Jody, so my co-host, Jody Scholes, for being here. Now, Jody Scholes, she is actually giving a TED Talk pretty soon here, in just a week, right?
That's
and
correct.
You're flying to Las Vegas and recording this TED Talk. Do you mind just telling us briefly what the topic is?
Yes, it's a TEDx. So the Farm League for TED, with fingers crossed that it's noticed. And the topic of the talk is "Our Pain Tells a Story." So it is about the psycho-emotional, spiritual causes of our pain versus just the physical causes. So based on the pioneers who have come before me, and that is Louise Hay, Carolyn Mace, traditional Chinese medicine, those points of view.
I love that, Judy. I'm really, really excited to hear it.
Thanks.
And so I want to thank both of you for being here tonight. And I want to remind everyone, if you're listening, to join us at the Educational Congress, which is July 25th through 27th in Philadelphia. And Jody, I think you're going to put a link in the comments for everyone. Okay. It's going to be a wonderful event, and it'll be wonderful to collaborate with each other and to increase the standards of our profession. We always want to do that. We always want to be better. I think that we really do give a lot of value to the public right now, but I think it's important to always be on the same page about continued growth and continually adding value to those that we serve. So good good afternoon to the two of you. Good night to me.
Good night to you, yes.
All right. Okay, I'll see you guys at the Congress, and I hope everyone listening has a wonderful day.
Yeah, see you in Philly.
Thank you so much.